Hello, my name is Wendy Major, and this is my informational speech for the Fundamentals of Speech class at Valencia College. American author Dean Koontz once said, "Petting, scratching, and cuddling a dog could be as soothing to the mind and heart as deep meditation, and almost as good for the soul as prayer." Perhaps that is why there have been so many pet adoptions since the beginning of COVID-19. However, there are many things that you need to take into consideration as far as medical preventative care before you go out and get a dog or a cat, whether that be adopting or buying them. Things to consider are vaccines, parasite control, and sterilization. I myself have worked in veterinary medicine for over 13 years now. It is my job every day to teach people how to care for their new family members. First thing, vaccines. Vaccines we start giving at about 8 weeks of age. This is for both dogs and cats. And we booster about every 3 weeks until they are at or over 16 weeks of age. This is because somewhere between that 8 to 16 week period, mother's immunity wears off. Trouble is, we don't know exactly when it wears off, hence doing the boosters every 3 weeks in between those ages, so we can try to catch it as soon as mom's immunity wears off to make sure that there is no lapse in immunity for the puppy or the kitten. Illnesses that we vaccinate for, the big one is rabies, that everyone knows about. It's the only one that is required by law, but it can be passed to humans, and that's why. There is no cure for rabies. It always ends in death. And in addition to that, there is also no test for rabies. The only test that you can do requires you to take a piece of the brain, and we cannot do that on an alive patient, human or animal. Other vaccines that we will vaccinate for and use for puppies and dogs, we'll use a combination that we commonly refer to as DAPP. Short term, we'll say sometimes distemper parvo. This is a combo vaccine that vaccinates against actually many different diseases for dogs: distemper, parvo, parainfluenza, and adenovirus. Parvo is really the big part of this that's super important. Parvo is the #1 killer of puppies, and it is a virus, so there is no cure. You can only support them while they hopefully get through it, but survival is not a very good chance, even with the best medical care. Survival is limited. We also vaccinate against leptospirosis. Now, we don't see a whole lot of leptospirosis here in the States, but there have been cases of it. It is passed through urine. And the reason it's such a big deal to vaccinate against that is because it can be passed to humans. Leptospirosis causes multiple organ failure as well. Then there's Bordetella. Bordetella is more commonly known as kennel cough. I like to describe it as the cold that goes around preschool. And so therefore, it's also a great idea to utilize that vaccine. For dogs, we also have optional vaccines such as Lyme vaccine, Lyme disease, just like humans can get, and then also canine influenza virus, which is very much like our flu, except that it is only in dogs, cannot be passed to people, but it can be passed to cats. So that can be a problem. Now for cats, we have a rabies as well. We use rabies vaccines in them as well. It's the same rabies vaccine for dogs. However, we also have a combination vaccine that we call FVRCP, or feline distemper, and it also vaccinates against a few other things such as calicivirus, panleukopenia, and the whatnot. Then, moving on, there is an optional vaccine for cats for feline leukemia. Leukemia is not a cancer in cats like it is in humans, and it's optional because cats get it from other cats that have it. So it's very important to test your cat before bringing it into a home or near another cat to know whether or not they have leukemia. And as far as using the vaccine for it, we commonly vaccinate kittens for it just in case. But once they're adults, it really becomes optional and is recommended if your cat goes outside or if you have any other cats in the household that go outside that could possibly contract it and bring it inside. So for vaccines, we have risks versus benefits. There is a very, very low chance with any pet that you can have a vaccine reaction. Commonly what you'll see with this is facial swelling or hives, sometimes excessive vomiting, and in worst case scenario, anaphylaxis. If you see any of these symptoms, you should take your pet immediately to the nearest vet you can to get treatments of steroids and antihistamines. You can also talk to your vet about possibly using antihistamines before vaccines to prevent the possibility or lower the possibility of any vaccine reactions. Now, if you don't vaccinate, however, the illnesses are much, much worse than the vaccine reactions. Like I said earlier, parvo will usually result in death. Rabies will always result in death. So it's really, really less likely that you're going to have a vaccine reaction than that you're going to have really awful catastrophic complications from not getting vaccinated and catching one of these illnesses. So, British author and dog trainer Barbara Woodhouse, she once said, "I have caught more ills from people sneezing over me and giving me virus infections than from kissing dogs." And that is quite true. Our second thing that we need to talk about here is external parasites, any type of parasite control. But external parasites is what I'll begin with. These consist of fleas, ticks, lice, and mites, to name some, the most common ones. Everybody knows about fleas. The common misconception, though, is that fleas live on the pet. They actually don't. They live in the environment, and they treat your pet like a cafeteria. They jump on, they eat, they leave. So usually if you see fleas, it means there's a lot more fleas around that you're not seeing. Some fleas can cause allergic reactions in dogs and cats. The saliva will make them itch and give themselves skin infections, usually, for the ones that are allergic to fleas. And then we have ticks. Ticks are a vector species, which means that they transmit disease. If a tick is attached to a pet for more than 24, 48 hours, then they can contract things like Lyme disease, Ehrlichia, anaplasmosis, to name a few of the more common ones that they can get from ticks. So prevention is very, very important for these things. We don't see lice so much, surprisingly, but then we also sometimes will see mites. There's a few different types of mites, and what you actually see on the pet whenever they're having an issue with mites is what we commonly refer to as mange. Then we have our intestinal parasites. These they usually get in utero from mom if mom has them, or they can get it from interacting with the feces of other animals that are infected, such as stray cats, other dogs, anything like that. Basically, these are exactly what they sound like. They're worms that live in the body. They will commonly cause diarrhea, sometimes they can cause anemia, and dehydration as well, and sometimes weight loss. Our more well-known intestinal parasite is tapeworms, which they actually get from eating fleas. So if you use a good flea control, then you won't have to worry about tapeworms usually. Now with tapeworms, you cannot get a tapeworm from your pet. You would also have to eat a flea in order to get tapeworms. So that's no worries there as far as that goes. Our last intestinal parasites are actually bacteria, Coccidia and Giardia. Giardia you can actually get from swimming in a lake. Humans can get it as well, so something to be conscientious about. And then Coccidia is something that is actually commonly found in rabbit poop. So any animal that comes in contact with rabbit poop should get checked for Coccidia. And then we have our deadliest parasite of all, heartworms. They're exactly what they sound like. They are a worm that lives in the heart. They cause damage to the heart, the lungs, and the vessels. And they are very difficult to get rid of. Heartworms are contracted by mosquitoes that are infected. They bite the host pet. And cats can get them as well. It's a common misconception that cats don't get heartworms, but they actually can. There is a treatment for heartworms in dogs, but I kind of compare it to chemotherapy. It makes them feel very crummy, and it's a long process, and it is very expensive. For cats, we actually don't have any type of heartworm treatment. So usually when a cat is starting to show symptoms of heartworms, it's kind of too late to really do anything about it. But if you catch it early enough, you can put them on prevention to keep them from getting more heartworms and hope that the heartworms die off before it causes any real trouble to the pet. Now, A 2019 American Heartworm Society survey of approximately 6,000 vet practices and shelters determined that heartworms continue to be diagnosed in all 50 states. And I'll show here, you can see a map of heartworm incidences. Of course, you can see that there are areas where heartworms are a lot less prevalent and areas where they're more prevalent, especially in the southeast United States, where mosquitoes are higher. However, there is no place where heartworms do not exist. They exist everywhere, even if less than one case per clinic per year. Now, our third point is for sterilization. Sterilization is super important because we have so much overpopulation of dogs and cats both. Basically, sterilizing is also known as spaying or neutering, altering, or fixing. For females we spay, we usually remove the ovaries and the uterus, and for males we'll remove the testicles. Now, there's different methods you could go about doing sterilization. One is low cost, which is a great alternative if finances are an issue. But in veterinary medicine, you get what you pay for. So low cost is going to be, the pet's going to be sedated, they're going to be gassed down with a mask, the procedure will be done, and then there will be no pain meds usually, and no cone for them to wear to keep them from possibly disturbing the incision. So, like I said, a great alternative if finances are an issue, but not ideal. Now, full-service veterinary hospitals usually will do these procedures, and it's more akin to human medicine. You do blood work beforehand, you put in an IV, you have full monitoring whenever they're asleep. Usually we sedate, then we will tube them with an endotracheal tube, breathing to help them breathe, and we'll go ahead and do that and have them on the full monitoring throughout the procedure. We're monitoring their heart rhythm, temperature, oxygenation, blood pressure, all of those things that a human would be monitored for when they were under anesthesia. Then we do pain medicine. We send home cones, sometimes something to help keep them calm, a little sedative to give at home, to make them as comfortable as possible while they're trying to recover from this procedure. Now, the risks of not sterilizing. In males, you do have the risk of testicular cancer as well as prostate problems. Usually you'll also have some behavior problems such as marking. Both dogs and cats will mark. And sometimes you have behavior issues too, such as roaming, looking for a mate, and sometimes, especially in the young dogs, they may challenge your authority and challenge your training. For the females, our thing that we can eliminate entirely with sterilizing is ovarian cancer and uterine cancers, and you can drastically reduce the chance of mammary tumors as well, and breast cancer basically. Now, the biggest thing that is a huge problem in both female dogs and cats is something called pyometra. Pyometra is an infection of the uterus, and it is always either fatal or you need to do emergency surgery to remove the uterus immediately. For every heat cycle a dog or cat goes through without breeding, it raises the chance of them contracting a pyometra right after that heat cycle. Symptoms of this is lethargy. Sometimes you'll see discharge from the vulva area, and they usually won't eat, run a fever. And like I said, emergency surgery is the only treatment for this. So if emergency surgery is not an option, then unfortunately either euthanizing or they will pass away. Now, University of Georgia, they conducted a study of 70,000 dogs, and the average age of death for intact dogs, that's dogs that are not spayed or neutered, was 7.9 years versus a significantly older 9.4 years for altered dogs. So it can lengthen their life by sterilizing them. So those are our three main factors that are super important in taking care of the preventive medical needs of a dog or a cat: vaccines, parasite control, and sterilization. So knowing these basic preventive medical needs is something that you will discuss with your veterinarian. You'll probably have many discussions with them when you get a new cat or a new dog. So now you know what to expect when adding to your family so that you can be prepared. Thank you so much for listening today.